what they call the drought response, especially in the nutrition program response for the 3 sub-counties of Lagdera, Dadaab, and Garissa sub-county. TDH had been very handy. They help support us in implementing the nutrition activities. As you know, Garissa County has what they call the GAM rate, which is the global equivalent nutrition rate of 22.1%, which is extremely high compared with the what do you call the Kenya Democratic Health Survey, which is about 17.5%. We have a stunting level of 9%, actually the lowest in the country, but we are fairly doing well. But the drought situation has actually increased our global acute malnutrition rate of 21.2%, which had been on the extreme side for the last 5 years. We have never seen such. Now that TDH has come, we have also other partners that are also implementing the nutrition program. We have got nutrition supplies that are plenty in the health facilities. We have got the nutrition, what do you call the health workers have been trained on what they call the imam modular training. Imam modular training help them to capacity build them in the management of what they call the severe malnutrition and the acute malnutrition. In other words, they are called the SAM cases and MAM cases. And therefore, this helps us in accurately managing the children at the community level. Community engagement is also one of the important aspects, and the communities are also being engaged at the grassroots level. We have got the community health units that are actually helping us. As you saw this morning, we have had the mother-to-mother support group that are actually relaying those messages. We have community dialogues, we have community engagements. Above all, we have what they call this outreach program that are actually happening in those 3 sub-counties. Along with that, we have got other nutrition partners such as Kenya Red Cross that are also implementing part of the DAP. They are also implementing part of Balambala and part of Lagdera. We have UNICEF, we have got Save the Children that are also implementing in 4 other sub-counties of Balambala, Fafi, Ijara, and Huluko. And therefore, the entire county, Garissa County, is actually covered in terms of implementation of the health outreaches. There is inclusion criteria when we are giving out the nutrition supplement. There are many. The nutrition supplements are many. They have got the inclusion and the exclusion criteria. We have a standard program by WHO that are there that children must be in the program. And then they are categorized according to either they are acutely malnourished, moderately malnourished, severely malnourished. Along with that, we have got the pregnant and lactating mothers who are also supposed to be in the program. They are called the OTP and SFP program. Depending on which program you are going to be in, you will be directed by the health workers. And that's why one of the key indicators is the health workers must be capacity built. They must know the inclusion and the exclusion criteria. No one can just decide in the morning and say, this child should be in this program, this child should be in this program. Actually, there are parameters set. There are nutritional screening that is supposed to be done. They are called the mid-upper arm circumference. There is weight monitoring. There is what's called Z-score. All those things are going to be put together to determine and tell us which child has got the right or the appropriate child to be admitted into the program.
Kikundi yetu ni ya kuelimisha wamama kuhusu mambo ya malnutrition, chakula bora, ulezi bora wa watoto, mambo na family planning. Tunapanga siku maalum, mara nyingi siku za weekend tunatembelea wamama, tunawaongelesha jinsi ya kuwalea watoto wao vizuri, tunawaelimisha kuhusu balance diet, ile chakula mtoto anahitaji kula ndio akue vizuri, akue na afya bora. Then tukipata wale watoto malnourished ambao wamelemewa sana, tunawapea referral, wanaenda hospitali ndio wanapata huduma kama wataadmitiwa ama wanawekwa kwa program ya, kuna wengine wanapewa plumpy nuts na wengine wanapewa unga ya uji, ambao ni wale ambao wamepoteza weight tu kidogo. But wale ambao wako serious wanakuwa referred kwa Garissa Provincial General Hospital, wanaenda wanakuwa admitted there, wanafuatiliwa kwa ukaribu, yani on daily basis. Wanapewa ile dawa itawasaidia na vile vyakula vitawasaidia. Hiyo ndio kazi tunafanya.
Sisi mara nyingi tunatembelea wamama vijijini kwa elimisha kuhusu malezi bora kwa watoto na lishe bora, na pia mara nyingi wamama mtoto akipitisha ule umri wa chanjo huwa hawafuatilii kupeleka mtoto kwa clinic. Sasa sisi huwa tunawaelimisha kwamba mtoto anatakikana kupimwa kila mwezi anatakikana kupata vitamin A akifikisha 6 months, na then wanatakana wadiwomiwe kuanzia 1 year. So wamama wameelimika kupitia sisi kuwatembelea, then tunashukuru siku hizi tunapata watoto tunawapatilia hivyo vitamin A wanapata, wanafanywa deworming, then wale wa malnutrition tunawarifa. Wakifika pale, kuna wale wako severe wanaanzishiwa wanawekwa kwa OTP, that is wanapewa ile plumpinut. Wale wako hiyo moderate wanapewa plumpisub. Na wamama lactating, wamama wajawazito, pregnant women na lactating, kuna wale kilo zao ziko chini, then mwaki yao pia iko chini. Kuna wale mwaki iko moderate, wanapewa uji. Kuna wale mwaki iko severe, inaonyesha mama wako severe, wanapewa uji plus ile plumpinut. So unapata wanaendelea vizuri. Hiyo ndio kazi yetu. Kuna challenges, hawa wamama ukiwatembelea kule kuhusu lishe bora, unapata mama anakuambia mimi sina uwezo kama huu, uwezo wangu ni wa chini. So vile tunamsaidia, tunachukua tu mama kama huyu, unampeleka kwa facility. Akienda pale, yule mtoto mwenye kilo zake ziko chini, mtoto anaandikiwa kama ni nut kulingana na kilo zake, kama ni sap, then mama anasaidiwa na ule unga wa uji, anaandikiwa pia, anawekwa kwa program. Hivyo vile tunawasaidia, lakini challenges huko umaskini.
Garissa, the nutrition situation remains very critical. Of course, it is estimated that over 60,000 children are malnourished. Of this, over about 17,000 of them are severely malnourished, and the rest are moderately malnourished. Now, as a part of the ongoing response, the county government has been working very closely, jointly with partners, including UN agencies such as UNICEF, WFP, and other international organizations such as Terre, Hommes, Save the Children, Kenya Red Cross, to be able to support the county to mount a response, to be able to address the cases of malnutrition in the county. We have seen that through this particular response, the county has been able to reach many children. Last year alone, over 7,000 children who were severely malnourished were actually treated, courtesy of the support, the leadership that is provided by the county government, and the support that they also get from different actors. The exercise has just ended, and we have, through that particular process, the department has been able to screen over 80% of children who are severely malnourished. They have been able to identify those who are malnourished. They have been referred, and also some of them were treated on site for malnutrition. The process is ongoing. We do hope that all those children who are already identified will be enrolled in the program and get cured and treated. Because of the response that was mounted, we have hardly seen any death as a result of malnutrition being reported in Garissa. This situation, the current drought situation, has been the worst over the last 40 years that we have ever seen in this country. And this was as a result of failure of 5 failed rainy seasons. We know that the majority of the community in this particular region, the children diet is largely milk. And we have seen the impact that this drought has had not only on the food prices but also on the livestock. Most of the households have actually lost their livestock, and even the little livestock that were there, they were so emaciated to the extent that they were not able to calve down. Now, for us to be able to see a serious improvement, it will take us close to 6 to 9 months or so, because you do know that even for the livestock, for a cow, it takes about 9 months. For a camel that largely provides milk here takes about a year, and the small livestock, they take about 6 months or so. So for us to be able to start seeing households having access to milk, this is likely to happen towards the end of the year or as early as next year. As you've rightly said, there are about 85 health facilities across Garissa County that is actually providing treatment for children who are severely malnourished. Out of that, the county has also mapped an additional 360 outreaches across the entire county. And of these, about 280 of them are currently being supported by the county government and various partners to be able to provide treatment for children across the county. Those who are extremely wasted or they're severely wasted, they are rolled either in the hospital if they also have other conditions, or they are managed from home under a program that they called outpatient therapeutic program. And those who are moderately malnourished are also managed at home when they are given ready-to-use supplementary feed under the supplementary feeding program that the county is running, jointly supported by also partners. Thanks.